Some patients describe that they're a challenge pulling their pants up, buttoning their buttons, or bringing their zippers. Quite often we'll recommend that instead of wearing pants with buttons or zippers, or belt loops, needing a belt, simply just wearing pants that have an elastic band can be very helpful. Getting up from the toilet, for example, where your pants can drop down to your ankles, and that could be a big problem for somebody that has weakness to reach down, grab their pants, pull them up over their knees. As an OT, what we try to do is we break down that activity from over your feet to knees and from your knees over your hips. So if a patient's able to get their pants on over their feet to their knees, but not from their knees over their hips, simply wear an elastic band, sweatpants, for example, or joggers, will keep your pants between your knees and your hips, requiring you to do less work to pull your pants up after you're getting on and off the toilet. Same applies if you're sitting on the edge of the bed to put your pants on. If you can't bend over, but you have some hand strength, you could use an assistive device like a reacher to grab onto your pants, to put your pants on over your feet. You get both feet in. Now your pants are between your feet and your knees. And the question is, how do you get them from your knees over your hips? And that depends. I mean, maybe you simply just stand up and pull them up. Maybe you need a walker to support you in a standing position so that you can safely pull your pants up one side at a time. And then, or maybe you may need somebody to help you. And then while you're maintaining your balance at the walker level, your caregiver can pull your pants up safely. Shirts can be difficult because of buttons, and also because you just may have shoulder weakness to the point where it's hard to get through the sleeves and pull the shirt on over your head. So again, a good OT will analyze that activity, determine if you have more strength in your right arm versus your left arm. The rule of thumb is you always put your weaker side in first, because you have much more strength and mobility from your stronger side to do most of the work. So quite often people have difficulty putting their socks and their shoes on. There are devices out there that can help you put your socks on. We try those first to see if they work. If not, sometimes putting your socks on requires the assistance from a caregiver. And quite often people will not wear socks because they're so difficult to put on. But shoes, on the other hand, slip-ons are always best because they take less energy. You don't have to tie them. You can replace your laces with elastic shoelaces where you only have to tie them once, and then they become slip-ons. And quite often we'll give out long-handled shoe horns to people so that when they put their shoes on, they don't have to bend over at the waist. We recommend that you try to avoid bending over at the waist, especially if you're compromised, if your breathing is compromised. You don't want to bend over the waist to perform any lower extremity dressing activity. If you have enough strength to bring your foot over your knee, this is an excellent way to reach your foot, to put your sock on, to put your shoe on. And then it's also an excellent stretch for your hip. And then, simply put your foot down and then switch to the other side. Same technique. If you avoid bending over, it's important because you'll be able to control your heart rate from rising, and you'll be able to control your respiratory rate from increasing. So these energy conservation, adapted techniques, use of adaptive equipment is all in an effort to help you maintain your independence without getting tired.